My name is Dr. Philip Huang. I'm an orthopedic surgeon here at Ortho Indy, and I specialize in hip and knee replacement. So as an orthopedic surgeon and hip and knee specialist, the majority of my practice is focused on hip and knee arthritis, hip and knee replacement, and revision surgery. I personally have a specific interest in a lot of different ways to make that easier for patients as far as facilitating an easier recovery, including outpatient or same-day total joint replacement surgeries, and also multimodal pain control, meaning we give the patients a lot of different pain medications, not just opioids or narcotics to help control their pain, to help mobilize them early and be able to get them out of the hospital the same day if they qualify for those operations. In addition to that, we try to use muscle sparing and minimally invasive techniques from a surgical standpoint to also facilitate a rapid recovery. And then a particular interest of mine is robotic-assisted joint replacement, and specifically total knee and partial knee replacement surgery. I believe there's a lot of value in that as far as being a less invasive surgery, likely less pain, swelling, bleeding in and around the time of surgery, which helps to facilitate an earlier, faster return to their normal activities and a recovery overall from those operations. As far as my personal approach to patient care, I really try to emphasize two things. First and foremost, I try to treat every patient like they're a family member or friend of mine and really give them an individualized aspect and treatment plan. We're all very different people, and arthritis can affect everybody in very different ways. We all have different interests, demands of our life, whether it be for work, for life, for fun, or otherwise. And I think really we need to take all those aspects into consideration in treating patients with arthritis or considering hip or knee surgery. So as a joint replacement surgeon, what brings me the most joy and what I do every single day is seeing these patients in the first couple visits after their surgery. Sometimes it's even the day after. Depending on the severity of their arthritis, patients undergo a very, very rapid transformation and recovery from this operation, which brings me a lot of joy and personal gratification in what we do and being able to see the smiles on patients' faces. For example, I just got a couple emails this week from patients who are anywhere from 3 months to a year out from surgery, giving me a lot of stories and feedback about what they were able to do. They are hiking mountains, they're out biking, playing tennis, pickleball, doing all the things that we had talked about previously as far as why they wanted to undergo that surgery in the first place, and then seeing them be able to live their lives and enabling them to do so is really just very rewarding for me.